Hello and welcome to our channel Bankers Vasco Hospital. I'm Dr. Moore Banker, interventional radiologist, and today with me we have our special guest Dr. John. He is an orthopedic surgeon from Singapore and Indonesia. So Dr. John is a subspecialty about the osteoarthritis of knee joint and arthroplasty. So let me ask you one question to Dr. John. Dr. John, what's your experience of the patients who are suffering from knee pain due to the osteoarthritis?
Right. First of all, I'd like to thank you, our Professor Dr. Moha Bankers, for this podcast. I believe that it's very important for all the audience to understand more about osteoarthritis because this is carry a big burden for the population, for the society, everywhere in the world. Probably a quarter of the elderly people, they have osteoarthritis. And so many people, when they end up in the last stage, they probably require my service to do the knee replacement, hip replacement, we call that arthroplasty. But nevertheless, so many people trying to avoid surgery because we know that the downtime, recovery time of surgery are very long. A lot of patients are suffering during that recovering period, and some of them even cannot really use or get back to the activity daily living. For example, like prayer and everything after the arthroplasty.
Yes. So I think so many prefer non-surgical treatment also.
Absolutely right.
So in Bankers Vasco Hospital, we are doing the non-surgical treatment that's called genicular artery embolization, and it works very well for the patients who are suffering from knee pain. And these are totally half an hour procedures, and
Yes.
patient can go back to home within a few hours. And it really works. In some patient words, it's a magical formula.
Yes.
No, without doing surgery, just one just pinhole procedures, it relieves the knee pain.
Yes.
So, Dr. John, you are here for this genicular artery embolization
Yes.
training program. So,
Yes.
how do you feel at Bankers Vasco Hospital, and how do you feel in Ahmedabad, in my city?
Right. I absolutely thrilled with the city. Of course, I'm Ahmedabad in India, and of course, I'm more feeling this. It's my great pleasure to be in the Bankers Hospital, Vascular Bankers Hospital, because everybody look like so warm and welcome. I feel like at home. It's my second home, and I already promised Prof. Moha to come back hopefully next year the same festival. That is my personal social experience. That's first. And the second thing probably I like to emphasize is very much that there are some alternative, especially for the patients that's not fulfilled the age. Patient with the young age that's less than 65 years old with the complete knee problems or hip problems with osteoarthritis, that they not really going into the category of arthroplasty. So we must have an alternative for them. Genicular artery embolization is one of the great alternatives. Like what I experienced during the practice of the vascular bankers in their hospital is really extraordinary because we see the patients like magic. They get, maybe I just explain this small little in the layman term about what's going on during the genicular artery embolization. We know that on our knee, there are few branches of vascular. And when we have osteoarthritis, there's vascular going inflamed. And sometimes during the inflammation, there is something we call the new angiogenesis, which is the blood vessels just get more and more. And then that's cause the pain. And that pain sometimes unbearable, and then what I don't like is actually the patient keep popping up the painkillers. Sometimes painkillers not only kill the pain, they kill the kidney too, they kill the gastrointestine, they kill other organs. That is, we try to stop that. With the genicular artery embolization, we just put the emboli agent, we call that, and we block that inflammatory artery. It works like wonder. It's beautiful and it's magical. And all the patients, I just got the call from one patient that I did 2 legs. He called one of the staff of Prof. Lata maybe yesterday. He said, "Oh my goodness, thank you. I can walk again without any pain at all, without painkiller at all, just normal. One day, you can imagine, that is such a extraordinary, breakthrough, groundbreaking treatments that's become our option."
Yes. Genicular artery embolization works very, very well.
Yes.
And I hope that we have fulfilled your desire to have a hands-on experience
Yes.
of genicular artery embolization.
Yes.
Number of cases are, I think, enough to have a hands-on experience, right?
Tremendous amount of patients in vascular bankers hospitals that may become so fluent with every steps, every safety and everything.
And Dr. John, can you tell me about some research molecule about the VHH?
Yes.
So tell me to our audience about what's the indication of using it and what's the mechanism of action of it.
Wow, that is really magnificent question. This is very good question from Professor Moha. I just back before I came to Ahmedabad. I just back from the World Orthopedic Conference. It's a huge event that's attended by a lot of professors, doctors with years of experience in orthopedics. So during that seminars, I brought my research, which is very well accepted and peer reviewed. What is the VHH? It's actually, there are a complex situation that's occur either in the knee joint or the hip joint or any joint that's being affected by osteoarthritis. And with this VHH, it's just a small molecule of our own antibody, we can really block them. So hopefully, one day we can do that without any surgery at all, without any cut off in our knee or our hip, without any stitches in our hip or knees, and this is going to be less. So let me give one analogy.
Yes.
Last time before 1970s, every people with the blockage of coronary artery, they need to go to CABG. We call it coronary artery bypass graft, meaning that they need to cut open the chest and then they need to do the bypass. That is the only treatment. Same like now, the only treatment, definitive treatment, arthroplasty, right? With this invention, I really expect that one day it's going to be like PCI or balloon that's standing. Now maybe less and less patients that's really undergo for surgery, open surgery. They just maybe go for a simple arterial stenting or something. Then one day this VHH, we call it makeup body, which is I apply the patents. I got multiple patents from Singapore patents office government that's already granted me few patents that's to justify my research and invention, and hopefully one day we can do a very great collaboration between vascular bankers and us in Singapore to use this VHH on top of genicular artery embolization as the great and prominent alternative to treat osteoarthritis without surgery. Yes, I cannibalize my own job.
Yes. So thank you, Dr. John, for coming to Bankers Vasco Hospital, and thank you for joining us in our team. And I hope so. You have very good experience in our hospital.
Thank you. This is just magnificent experience. It's just great and sweet experience that's unforgettable.
And next year, I think so, in this Navratri festival
Yes.
in my city,
Yes.
you will enjoy the Dandiya and Ras again.
Yeah, this is one thing that I'm going to bring over here. It's so coincident, it's so fortunate for me that I can come during this festival. So I experienced something that's unique, maybe first time in my life that I really dance the Garba. It's in Gujarat,
Garba.
Gujarat traditional dancer.
Yes.
And I danced with Prof. Maha for almost 3-4 hours until in the early morning. And there's one good thing is my good brother, Professor Maha, his wife told me that's the first time he danced like that. So that's really unforgettable experience. It's really thrilled me and it's really give me a good memory about Ahmedabad. I will come. Definitely I'm going to come here. All right. Thank you so much, Prof.
Thank you so much.
Thank you.